There's been a long-standing need for family medicine physicians in particular. No one's immune to the nursing shortage right now.
Oklahoma ranks 42nd, I believe, in the number of physicians per capita, and that's statewide. The shortage of physicians in rural Oklahoma is rapidly approaching the critical state. Physicians and nurses are vitally important to any healthcare system anywhere, so we've got to do what we can to shore up the recruitment of those types of professionals, to increase the educational opportunities for our Chickasaw kids and other kids to pursue those particular career paths.
The Chickasaw Nation is doing amazing work in trying to make sure that there is an increase in access to primary care services and specialty care services. They've been recognized by Joint Commission, Oklahoma Quality Foundation, and recently awarded 5 stars. The Chickasaw Nation Medical Center is one of just a handful of hospitals that was awarded 5 stars.
Chickasaw Nation has always seen the importance of investing in our young people for their educational future. We have established a family practice residency in partnership with Oklahoma State University, where physicians can do their family practice residency here.
We're extremely proud of the efforts of our health system establishing a family medicine residency program here at Chickasaw Nation Medical Center. We have 3 satellite clinics, and they get to experience a little bit of all rural kind of practice.
Studies will show that most physicians will end up practicing permanently within just a few miles of where they complete their residency. So we hope that will help us recruit and retrain more family practice physicians.
I've been lucky enough to have received the Chickasaw Lifetime Scholarship. There's a need for physicians in rural and underserved areas of Oklahoma, and that's where my heart is. So I will give back 2 years of service after my education to our people.
We have unique partnerships with universities across the state to further the education of nurses. And if it wasn't for Chickasaw Nation and other tribes across Oklahoma, I think healthcare in rural Oklahoma would be even more difficult to recruit and retain health professionals than it is now.
The Chickasaw Nation Higher Education Department helped me drastically in undergraduate as well as a master's degree. They've also been involved with obtaining my doctorate degree, which is a doctor of osteopathic medicine. My goal is to go back to a position in emergency medicine and try to recruit more Native Americans into these healthcare/STEM fields, and how can we do that? I think much of that is just putting our faces out there, providing that mentorship that somebody look up to that, again, that I didn't have or that many of these youth currently do not have. I want to be involved with IHS or some type of Native facility in order to help my people.
You'll hear a lot of tribal leaders say, we think about it in terms of 7 generations into the future. The decisions that we make today are going to impact our kids and our tribe well into the future.
We take a load off of the private sector health system by providing those services that we are supposed to provide to eligible First Americans. If we weren't here, the medical infrastructure, I believe, and several other infrastructures would most likely and rapidly begin to crumble away.
Part of the things that I think made us successful was working together with all of our neighbors. Those are the cities and the counties that we live within.
Wherever the Chickasaw Nation needs me, I will serve. And so I'm very thankful for that scholarship helping me through my education. I definitely want to stay here and practice in Oklahoma and give back to the community that has given me so much.
Healthcare is extremely important. It's one of the major pillars of our efforts in helping to create a healthier community, a healthier tribe. We've had some success, and we want to continue to do all we can to help promote health and to help our citizens and communities be healthier.
Oklahoma thrives together.